So now we're going to talk about actually delivering your baby. As I've said before, no pressure, no pushing. Once you feel pressure, we'll get you to start pushing. And the pushing phase lasts somewhere between 1 and 2 hours. And as I said before, there are a number of positions that we can try. And you'll start that with the nurse and the nursing student or the assistant. But as we start to see the baby come down, that's where they'll call either myself or one of my colleagues and the residents into the room to prepare for the delivery. We will help you push through the last little bit, and we're going to protect your perineum so that you will tear. You're not going to get by without tearing, but that when you tear, the tear is as small as possible. So now we start to see the head come down, and we start to see you getting closer. The nurse will call the obstetrician and the resident and an assistant nurse to be there. If your baby has been well throughout the labor, there have been no heart rate drops and there are no concerns, the pediatrician will typically not be in the room but close by. If there are any concerns about the well-being of the baby at birth, the pediatrician will be present in the room at the time of delivery. And so as we start to see the head come down the birth canal, we will take a warm cloth and apply it to your perineum, and we will instruct you on how to push, and you'll keep on pushing the same way that we've been telling you. Deep breath, hold it, push, 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 3 pushes for 10 seconds each. But as we start to see the head crown, we will say to you, we don't want full pushes, we want half pushes, so the head doesn't pop right through, so that the head is delivered in a slow and controlled fashion, and we have a warm cloth on your perineum to support it. Also, what we do with our fingers is we, more than gently, but we do a gentle stretch of the perineum. Now, patients ask me, do I need to stretch my perineum before labor? Definitely, definitely not. That is not recreational, and it definitely does not help labor at all. It is when we see the head, that's when we may start to stretch the perineum. We will not cut an episiotomy. We do not cut an episiotomy unless there's an absolute reason to, and the only reason would be for the baby's heart rate to be dropping very, very profoundly. So we will stretch, we will support, but we will not cut an episiotomy. And so as we start to see the head crown, we will say to you, stop pushing, and then give us little grunts, and you'll go, instead of the big hearty push, and then a few grunts, and then we'll say to you, pant, and you'll go instead of pushing. So you'll push hard first, and then little grunts, grunt, grunt, and then and we'll tell you what to do. And when you start to pant, that's when the head comes out. Once the head is out, you are done. The rest of it is our job. And once the head is out, we will gently guide the baby out. The baby comes out, and the baby comes onto mom, skin to skin, uninterrupted for 1 hour. So the baby comes out, warm and wet, directly onto mom, skin to skin, uninterrupted for the golden hour, for the first hour of life. We wait at least 2 minutes before we cut the cord, and we put a little clamp on. And partners, if you want to cut the cord, we'll ask you, do you want to? And if you want to, absolutely fine. You cannot mess it up. I remember one of my patients said to her husband, don't mess this up. You cannot mess it up. So if you want to cut the cord, we'll offer you. If you feel up to it, fine. If you don't, there's no shame. We'll do it for you. So baby comes out, baby comes warm and wet onto mommy's skin, skin to skin, uninterrupted for the first hour. We wait 2 minutes, we clamp the cord, and then we cut it, and then baby is all yours. If the baby comes out not very vigorous, baby's not breathing straight away, baby's a little floppy, then we will stimulate the baby, we'll rub the baby, dry the baby, and if that doesn't work, the pediatrician who's standing outside will come into the room and we'll give the baby to the pediatrician to try and stimulate the baby. And once the baby cries and the baby's pink and the baby is well, the baby comes back to mommy and daddy as soon as possible for as long as possible. Once the baby is born, the nice nurse who's been looking after you will say to you, "Can we give your baby the eye drops?" And you will say, "No, I do not want my baby to have the eye drops." The eye drops are to treat gonorrhea, and none of you have gonorrhea. And even if you did have gonorrhea, guess what? The eye drops don't treat gonorrhea. So why would we give the baby eye drops that don't treat something it doesn't have? It's a standing law of most countries, and this law dates back to the 1950s, where there was gonorrhea and the eye drops did treat gonorrhea. But now gonorrhea is very, very rare, and gonorrhea is resistant to the erythromycin eye drops. But because it is a law, and because you are declining it, you will need to sign a waiver, and you'll do that afterwards. So the nice nurse will say to you, "Can we give your baby the eye drops?" And you say, "No, thank you, no eye drops, because the eye drops will inflame my baby's eyes." Then she's going to say to you, "Can we give your baby the injection of vitamin K?" And you say, "Yes, we want the injection of vitamin K because that is a good thing." So baby comes on you skin to skin right away. Eye drops, no. Injection, yes. So while you're cuddling, we are going to deliver the placenta. The good news is the placenta has no bones. It just comes out. It takes one push. So what we'll do is while you're cuddling your baby, we'll be rubbing the uterus, making sure the uterus contracts nicely and pushes the placenta out. And then we'll say to you, "Give us one last push," and the placenta comes out. The placenta looks like liver and tastes like chicken. I do not recommend that you eat it, and I do not think that you need to take it. If you want to take it home and plant it, by all means, but most patients just leave the placenta with us. There is a process called placental encapsulation, which there are some people in the community who take the placenta and turn the placenta into little vitamin capsules. These capsules have never been shown to clinically make any difference. If you want to do it, let us know, and we will package and give you your placenta. You have to sign a release form for us to do that, but that's not a big deal. Instead of taking the placenta home and encapsulating it, eating a piece of meat has the same outcome. So do I think you need placental encapsulation? No, but if you want to, let us know. We'll give you the placenta. There are companies that can collect some of your baby's blood in the cord called stem cell banking. These are private companies. They're all above board. They're publicly traded companies. And they collect your baby stem cells in case your baby will need, in case your child may need a bone marrow transfusion later in life. Why would that person need a bone marrow transplant? It's for cancer, for leukemia, lymphoma, very, very rare conditions. Stem cell banking is not a lot of value for money. It costs about $5,000 all done. I do not think, and not only do I not think, but the people that do the bone marrow transplants will agree with us that we typically do not think there's a lot of value to be obtained from private stem cell banking. If you want to do it, there are a number of companies who will provide the service. You pay them, you bring the kid to the hospital, and we'll collect your baby stem cells. But do I think you need to do it? The answer is no. However, there is a publicly funded stem cell bank which does not cost you anything, which is a public service, and if it is up and running, because it's not running all the time, if it is running, we will ask you, are you willing to donate your baby stem cells to this program? And their answer is yes. It doesn't cost you anything. You're not going to do anything with the stem cells. So if we can use the stem cells either for research or to help somebody else, that would be very beneficial, very altruistic. It is a free service for the population. So free stem cell banking, yes. Private stem cell banking, no. placental encapsulation, whatever. Now, all of you will tear. All of you will tear. Hopefully a small second-degree tear, and we will repair that while after we delivered the placenta and while you're cuddling your baby. If you have an epidural, you will not feel this. If you do not have an epidural, we'll give you some local anesthetic into your perineum, and we repair the tear with dissolving stitches. And the stitches go internally and they dissolve. You do not need to look at your stitches. We do not need to remove the stitches, and you do not need to care for them. So just leave them alone. Once we've repaired them, we will give you pain medication, and you will need lots of pain medication. And everything we give you, the Advil, the Tylenol, is safe for breastfeeding. If you need more pain medication, we give you something called hydromorphone, which is a first cousin of morphine. It is very good for pain control and is good for breastfeeding. So we will repair the tear with dissolving stitches. There is nothing to do. You leave them alone. They dissolve usually by 2 weeks. How do you keep the area clean? Because every mom is obsessed with keeping that area clean. You don't really have to, but we do give you a little squeegee bottle that after going to the washroom, you can spray the area with warm water. I think that sitting in a warm tub of water 2 to 3 times a day feels good and helps keep the area clean. But if you don't have the time to do that, that is fine. Your bottom will not get infected. There is a good blood supply, and typically the bottom, just like the mouth, does not get infected. You will have hemorrhoids, and we will give you hemorrhoid cream. If you've been pushing in the squatting position, you will have massive hemorrhoids, and we'll still give you the cream for that and some ice packs. So hemorrhoids are common. We give you hemorrhoid cream for that. We also give you stool softeners, and we will give you a laxative as well. Every mom dreads their first bowel movement. It typically happens only 2 to 3 days after the baby is born, and most women say, you know what, it wasn't as bad as I was expecting. It actually was quite fine. So ladies, there's nothing to worry about as far as taking care of the stitches go. They dissolve by themselves. You do not need to clean the area. You can sit in a tub if you want to, and going to the washroom is not going to be as bad as you think it is. What really makes a difference are the Tux medicated pads. In my list of what to bring to the hospital with you, I've got a little line which says Tux, T-U-K-S, Tux medicated pads. They are bum wipes, they're medicated pads, they have witch hazel, which you'll wipe your bottom with after going to the washroom, and it makes the whole area feel quite comfortable and soothing. So do you have to use them? No, but I would suggest along with the pillows, bring some Tux pads to the hospital with you. We have the stool softeners, we have the laxatives, and we have the squeegee bottle for you. So do not worry about the tearing and the stitches. That'll all be taken care of. Once you've had the baby, once we've finished repairing, we'll get you to sit up and we'll instruct you on how to start breastfeeding right away. If you're very tired, exhausted, you don't feel like breastfeeding, that's absolutely fine. The baby will stay on you, or if you're very tired, you can give the baby over to your partner. You have a break, we give you some tea, we give you something to snack on, and then as soon as possible, we're going to start the breastfeeding.